I'm the benefits attorney for ProBenefits. It's good to be with you this morning for our 9th webinar of our 2013 client webinar series. Today we're going to talk about the Health FSA rollover. We'll conclude our 2013 webinar series next Thursday with our final healthcare reform update of the year, so you're welcome to join us next Thursday as well. Hopefully you received an invitation to that webinar, but if you did not, let us know. I am also here today with Chris McCauley. Chris is our new benefits attorney who joined us in August, and Chris is doing a great job. We decided in strategic planning this year that in this healthcare reform era, which as you all know has been a time of frenzy in every respect for employers and for benefit compliance, that not only are our clients growing and their challenges growing that they're facing in benefits, but the law is becoming increasingly complex. So in our continued focus on communication and compliance for our clients, we decided that we need to give our clients more resources. And so that's the reason that Chris's position was created, and Chris has joined us and done a great job. So I'm happy to have him on the webinar today. The reason we're gathering today is new information, and that is the Health FSA rollover that was adopted or issued by the IRS for the first time on Halloween, October the 31st. The IRS during the healthcare reform era has not missed many opportunities to issue new guidance on holidays, and they didn't miss one for Halloween. So the new Health FSA rollover is an option for all FSA plans for the current plan year or going forward. We're going to talk through today with you the details of the rollover, what you need to do if you'd like to adopt the rollover, how we're going to implement it, and those types of things. Before we go any further, just a brief word of instruction. I know that many of you now are very familiar with the GoToWebinar software. You should have a control panel on the right where you can control your audio, and if for any reason you do not hear Chris or I clearly during the session, you may choose to go away from your speakers and click, and there's a number you can call and listen by phone. Also, we are going to take questions during the webinar, address some of them in writing and some of them raise them verbally. You can use the question box. So we don't typically check the chat box, but you can submit questions through the question box, and we will either get through those questions during the session, and we're going to have some Q&A time in, or we will get back to you with an answer later, but you're welcome to submit a question anytime. There's the agenda. Let's just go on. First, I thought before we talk specifics of the new IRS notice that was issued on October the 31st, I thought it might be helpful to put in perspective where we have come with FSAs and why we have the rollover now. Why not before? This seems long overdue. Put this in perspective of where we are. First, FSAs have been around forever. They were established in 1979. Very little has changed with the way FSAs work over the years. They were established as a vehicle for employees to put their own money in a tax-favored account to spend on qualified medical expenses and save taxes for the employee and the employer. From the first time that FSAs were established, the bedrock principle of FSAs was no deferred compensation. No deferred compensation in the way that there's deferred compensation, for instance, for retirement plans, that FSAs had to be a one-year plan, and everything had to happen within the same year. So one reason there was no rollover and that use it or lose it was present from the start is that the idea was that money is deducted in the same plan year from participant salary and used in the same plan year. And it was a year-by-year plan, not a deferred compensation plan, which would have had separate tax consequences in the same way that retirement plans do. So that's why it was set up as an annualized plan with an annual election rule and the annualization rule in terms of expenses can be reimbursed at any time. So those rules have been in place forever, and that's why there was no rollover to start with, because health FSA plans, just like other health and welfare plans, are different than retirement plans with no deferred compensation. Not much change from 1979 to 2001. In 2001, over-the-counter medications were allowed as eligible expenses for the first time. Just coincidentally, this came about 6 months after the federal government instituted a health FSA plan for its employees. Suddenly, the IRS allows over-the-counter meds in 2001, so that was huge, and that helped fuel great popularity of FSAs during the next decade. No big changes until 2005 when the IRS granted an optional grace period, and the IRS basically told employers and employees, we're not willing to give rollover, but we will allow you an extra 2.5 months if you want it at the end of the plan year, where expenses can not only be submitted but also incurred. About 50% of health FSA plans adopted the grace period and have used it since the end of the 2005 plan year, and it has been helpful for some, but it's certainly not a cure-all, and it's certainly not been something that has encouraged individuals to participate more, because as we know, use it or lose it has always been the #1 reason that employees waive participation, and the grace period really didn't do a lot to alleviate those concerns from risk-averse employees. So the grace period was kind of a nice option, but not incredibly effective. Not much change between 2005 and 2011 when, as part of the Affordable Care Act and just a revenue raiser for the Treasury and IRS, healthcare reform disallowed over-the-counter drugs. So over-the-counter drugs were given to us in 2001, taken away from us in 2011. Not a great change there for FSAs. 2013 is when the $2,500 annual limit on employee contributions took effect. That annual limit applies to employee salary deductions. It's a per employee limit, so that one employee could do $2,500 and the other spouse could do $2,500, whether at the same employer or a different one. It's just a limit on employee contributions. So if an employer is contributing either seed money in the FSA, matching credits based on how much the participant contributes, or wellness credits for participation in a wellness program, any of those credits would not count against the $2,500, and the employer could put in employer money in addition to what the employee put in. So once we have the $2,500 limit, where as before, to confirm, there was no limit. An employer could put in, have a $10,000, $15,000 max. We had some clients that did that, not many. The average maximum was more in the $4,000, $5,000, $6,000 range. But once the max was limited to $2,500, rollover started being a more relevant topic of discussion. So in 2013, the IRS said that they were considering rollover. They invited comments from employers and the industry on the rollover, and really considered it seriously for the first time. One of the reasons for the timing of the rollover is that once the maximum was set at $2,500, the IRS was less concerned about people stacking up, big balances in health FSAs. And also, I think the IRS has realized that, they've limited the tax impact with the maximum and with over-the-counter drugs not being in there, so they felt like they needed to give something back to participants, many of whom are scared of use it or lose it, many of whom, the IRS has heard all the horror stories about end-of-the-year spend down and people buying the big buckets of Advil at Walmart and then giving away those packs of Advil and Christmas stockings. The IRS has heard all those stories, prescription sunglasses and everything else, so they decided, one way we could alleviate the end-of-the-year spend down, alleviate the employee fears of use it or lose it, is by allowing a limited rollover. And so on Halloween, the IRS issued Notice 2013-71, which granted the rollover option. Now, to confirm, this is an option for employers. It is not required. We expect that nearly all FSA plans will implement the rollover, either for the current plan year or no later than the next plan year, but it is not technically allowed. What the rollover says is this: is that any unused amounts in health FSA as of the end of the plan year may be carried over up to a maximum of $500. So that's not a $500 per year carryover, it's a $500 total carryover. And Chris is going to go through some examples in a moment that will illustrate this better. But in any one year, at the end of the plan year, no matter how many dollars are in the plan, if someone has $1,000 left over that's not spent, they could carry over up to $500. If someone has $25 left over, they could carry over all $25. But $500 is the maximum rollover that would be allowed from one year to the next plan year. And this, number one, does not count against the $2,500 year cap. So someone who elects $2,500 for an FSA plan year and is carrying over $500 from the prior year would have $3,000 in the plan. Secondly, as Chris will explain more, it doesn't impact the claims runout period, so that someone who has money left at the end of the plan year but just hasn't turned in expenses from that prior year, they're still going to be able to turn in the expenses and get reimbursed from their claims runout dollars from their prior year election. Chris's examples will explain that better. Importantly, the rollover is a replacement for the grace period. So an employer cannot have the grace period and the rollover. It's either or. We really think the rollover is going to completely replace the grace period. That's not going to happen immediately. Some plans may choose to keep the grace period this year or even next year, but eventually the rollover will take over the grace period. So for now, a plan could choose to not have the grace period or the rollover, which is where some of you are. If you have the grace period and you want to keep it for the current plan year, you can. If you want to drop the grace period and go to the rollover, you can. But the rollover and the grace period are mutually exclusive, and I think that's a very important point. What does the plan need to do to adopt the rollover? We'll say more in a few minutes about our plan for implementation, but basically, for those of you, everybody on this call I think is one of our FSA clients. If you want to adopt the rollover, all you need to do is let us know. And we're going to take care of the back office work on it, the implementation, and then we need to update your SPD to include the rollover. Specifically, or most significantly, if you have the grace period now, we need to implement the new SPD so it removes the grace period and adds the rollover before the end of your current plan year. The IRS notice technically would allow a plan to wait and amend the SPD by the end of the following plan year after the rollover has been implemented, but our recommendation is to go ahead and do it now. We want your SPDs to be as compliant as possible, and we feel like that's part of our compliance responsibility for your plan, so that's what our recommendation is. Now, what amounts may be carried over? The specific verbiage in the notice is unused health FSA amounts, as quoted there in the top bullet point on this slide. What those amounts technically are funds that are remaining after the claims runout period. And Chris is, again, going to go through some examples. But technically what's rolled over is the amount that after the claims runout period has expired and claims have been processed that can apply to the prior plan year, that after that the book is closed on the claim runout period, anything left over would be rolled over. That's technically what's rolled over. Now, as Chris is going to explain, really the rollover can be implemented first day also. So it's almost once the new plan year starts, the rollover money, if there's a balance in that participant's account, could either go toward new plan year expenses or old plan year expenses up to $500 when we're looking at the new plan year. Chris's example is going to explain that better. But during the claims runout period, we're going to assume that current year claims are applied to current year elections. That's kind of the basic default ordering rule, unless we've been instructed to do otherwise. But just to clarify, $500 is the cap. So if someone, for instance, had $1,000 left in their plan and they went through the claims runout period and didn't submit any expenses for the prior year, then only $500 could be carried forward. But if they've got $1,000 left on the last day of the plan year and they still have some claims from the prior plan year, they can still submit those, and anything not reimbursed from those dollars would roll over to the new plan year. I'll mention briefly that in terms of termination, it's still true that if someone terminates, anything they've got in the FSA is forfeited. That person may be eligible for COBRA, and if they are, their COBRA balance would carry forward if they start paying a contribution, the effective COBRA premium on a monthly basis. But there is no change to the circumstance that when someone terminates, they lose the money unless they elect COBRA and continue the benefit. And if people don't spend the money, it's gonna go away. The rollover could go on for a while, but people that don't submit claims are not going to get it via cash out or paid as comp or anything like that. All right, Chris. I tell you what, before you go to the examples, I did insert one slide here just as kind of a big picture look here, and that is, is this FSA rollover good news? My perspective is yes. I think it's the most helpful news for FSA plans and participants that we've gotten since the grace period in 2005. Realistically, it's probably the best news since over-the-counter drugs were added in 2001. Here's why. The current national average for FSA participation is 1 out of 5, 20%. And as I said a moment ago, the number one reason that people do not participate is use it or lose it. And when we do group meetings and employee webinars, the number one feedback we get for non-participants is use it or lose it scares us. We don't want to lose any money, even though most participants don't lose money, and very few of them do lose money, and those that do lose money lose a very small amount. That's less than they saved in taxes. But despite that, people don't participate because of use it or lose it. Well, this rollover effectively kills use it or lose it. No one is losing more than $500. I mean, no one in terms of far less than 1% of participants are losing more than $500. So this effectively kills use it or lose it. So it should help participation. So I think why this is good news is for employers, more people should participate, and that's not only going to save your employees money, but it's going to save you, the employer, money, because on every dollar contributed by employees to the Health FSA, that's creating FICA tax savings for the employer at 7.65%. And whether some of you have done the math on this or not, most of you are saving more in FICA than you're paying to have the FSA plan. So FICA savings are huge, and we think, and based on the studies we're reading, we think that participation could be increased by 25 to 50% in the first 2 years for plans that adopt the rollover and promote it. And promoting it is going to be a big key. So we do think this is a big deal, and we do think that use it or lose it is effectively killed, even though, of course, we don't want to misstate that any amounts over $500 could be forfeited. Chris, can you take us through some examples?
Sure, Jason. And again, welcome to everybody out there in attendance. I just want to walk through a couple of examples that illustrate the rollover scenarios that a participant could run into. After this webinar, if you're still interested in some more examples, I know the IRS notice has some pretty in-depth examples that if you want to check those out, you can do that by getting a copy of the notice as well. But just to jump into the examples, the first one I want to talk about is just a simple rollover scenario. And for all of our examples, we're just going to assume a calendar year FSA plan with a standard 90-day claims runout period. So in example one, the participant has $600 of unused FSA funds at the end of 2013. And then the participant also makes a new election for 2014 of the maximum $2,500. During the claims runout period for 2013, no expenses were submitted. So no additional claims submitted. So at the end of the runout period, the participant still has $600 from 2013. Of that $600, $500 will roll over from 2013 to 2014 because, again, the maximum is only $500, so that the participant has $3,000 available for medical expenses in 2014. That $3,000 is made up of $2,500 from the new election and the $500 rollover. And then of the unused $600, $500 is rolled over, but $100 will be forfeited. Not 100% ideal for the participant, but again, with the rollover, that's better than no rollover when they would have lost $600. So that's simple rollover example one. Example two is pretty simple as well. This time the participant has $1,000 of unused FSA funds at the end of 2013. Just like the last example, they make a new $2,500 election for 2014. Now this time during the claims runout period for 2013, a participant submits a claim for a $500 expense incurred during December 2013. That's a prior year expense, so it needs to be reimbursed with prior year funds. And so the participant had $1,000 left over at the end of last year. That participant is reimbursed for the new expense submitted during the claims runout period for $500. So of the available $1,000, now there's only $500 available. No more expenses are submitted during the claims runout period, so that remaining $500 from the end of 2013 rolls over from 2013 to 2014. And again, just like the example, in example one, $3,000 are available for 2014 expenses. And I think that's a good example of how the claims runout period is not affected by the rollover. They can be used in conjunction with one another, and that's an example of a participant taking advantage of the claims runout period even with the rollover. We can move on to example 3 now. This one's a little more complicated. I'll do my best to walk us through it. Again, just like the last example, the participant has $1,000 of unused FSA funds at the end of 2013. And again, he makes a new $2,500 election for 2014. On January 25th, the participant submits and is reimbursed for a $2,700 claim incurred on January 15th of 2014. So this is a new year claim. So that will be reimbursed. The first $2,500 is reimbursed from the 2014 election, and the last $200 is reimbursed from unused 2013 rollover. I think it's important to note here that that $200, because it's being used to reimburse a new year claim, is considered rollover funds. So as we get further into the example, you'll see that that $200 is going to be applied as rollover when we get to the end of the claim runout period. So if you're keeping track in your office, after the claim is paid, the $2,500 new election has been exhausted, and $800 remains from the 2013 unused funds. So of the 1,000 unused funds, 200 was used to reimburse the large claim, and now there's $800 of unused funds still remaining from 2013. And just as a refresher, the 2013 funds must be used for expenses incurred prior to 12/31/13 when submitted during the claims runout period. And then whatever can be rolled over will be rolled over at the end of the runout period. So just remember, as we move to the next slide, there's still $800 remaining from 2013, although $200 has already been rolled over. On February 15th, we're still within the runout period. Participant submits and is reimbursed for a $400 claim incurred during 2013. So again, this is a prior year expense that needs to be reimbursed with prior year funds. That's perfectly fine because that's all we have left after the 2014 election was exhausted. So that $400 claim is reimbursed, and now only $400 remains from the 2013 unused funds. No more expenses are submitted during the claim runout period, so now we can determine what needs to be rolled over. Because $200 of the 2013 funds have already been rolled over in the large $2,700 expense, only $300 of the remaining funds can be rolled over to 2014. Again, the maximum is $500 rollover, $200 already rolled over, and now $300 remaining at the end of the claim runout period can be rolled over. There's still $100 because $400 were actually remaining. So that $100 will be forfeited. Again, not completely ideal for the participant, but much better than had there been no rollover. So this is another good example of the participant taking advantage of both the claim runout period and the rollover. After those examples, Jason, are there any questions you want to get to before we jump into some of the other information?
Yes, Chris, thanks. And by the way, if anybody followed that example 3, congratulations, and we got a gift card in the mail to you right away because you're right where Chris and I are. But the good news, as we jokingly put at the bottom of as we jokingly put at the bottom of the slide, the good news is we're going to be tracking all this, and we're developing our software and card systems to track this so that you won't have to, and we'll get into your action plan in a moment. In terms of questions, I had a couple of questions, Chris, about the grace period, and more specifically, a couple of questions said, can we clarify what the claims runout period is? Just to clarify, what the claims runout period is the 90-day period that's built into all of your plans where participants have 90 days after the end of the plan year to submit claims from that prior year. So in the basic claims runout period, let's just keep going with the calendar year example. Someone's got a calendar year 2013 plan. They have 90 days through March the 31st of 2014 to submit claims or expenses that were incurred no later than December 31st. So the claim runout period is just the claims deadline. That's different than the grace period. The grace period, which is completely optional for plans, would allow someone to both incur or submit expenses within that. The grace period is 75 days. So the claims runout period, all of you have it. The grace period, half of you have it. The grace period is what has to go away with the rollover, but every plan will still have a claims runout period, and the standard claims runout period is 90 days. Another common question has been, whether we're going to provide the the slides. In fact, we're going to provide a copy of the slides to everybody on the webinar today. Also, we're recording the session, so if you want to have a copy of the recording to share with a member of your team or someone else for whom it will be helpful, we'll be providing that to you likely later today. Chris, another question that's come up says, what if we're not a calendar year plan? Let's say that we're a July 1st plan, and we decide we want the rollover and we want it for the current year. Would that be a qualifying event that would allow employees to jump in mid-year since we're adding the rollover option?
That is not a qualifying event, Jason. The only way the participant could jump in mid-year is if they had one of the regular status events occur before open enrollment, but adding the rollover itself is not a status event which would allow the participant to join mid-year.
Chris, another question is whether an employer could allow a rollover max of less than $500 if they chose.
Absolutely. The employer has the option to allow a $500 rollover, no rollover, or some intermediate amount of rollover, say $300. I don't really see at this point a practical reason for allowing a number less than $500, but perhaps there's employers out there that have a reason, and they certainly could do that if they decided they wanted to.
Chris, another question. Let's say an employee is participating, let's just go back to the calendar year example. An employee is participating in 2013, has funds left that are going to carry over. Let's assume no claims run out. Those carry over, but that participant does not elect to put in any new money for 2014. What would that person's balance be, and when could they get reimbursed?
I think we're still working through that, and I think that might be a case-by-case situation for the employer. If the rollover amount, if there is rollover funds and then a $0 election, I think the default would be that they would have the rollover amount for the new year. They wouldn't need to make a new election, but I'm guessing that's going to be a case-by-case situation going forward for employers. Maybe you have more to add to that as well.
Yeah, no, I think that's well said. Some really good questions coming in. I'm going to get through the next couple slides, and then we're going to come back so we can get all of the questions. Before we do that, Chris, would you, and this relates to a couple of questions that have been submitted as well, as we get to some of these additional considerations compliance-wise, one of the questions is, how would, in that same scenario where a participant is in the plan this year, they don't elect next year, could that affect their ability to use an HSA bank account in the next year?
Yeah, it's certainly possible. I think some of these additional considerations are interesting because there's certainly things we need to think about, but they weren't addressed in the IRS notice. So we're doing our best to apply rules that were in place prior to the rollover, and so in some ways it's like putting a square peg into a round hole, but we're going to do our best. In terms of how we interpret the HSA eligibility, and just to start from the beginning, generally if someone is covered, a participant is covered under a general purpose health FSA, they are ineligible for an HSA bank account for the period of time for which they are covered under the FSA. And so just as an example, if I'm a participant in a 2013 calendar year FSA, I would be ineligible for an HSA bank account until 2014 at the earliest. Even if I exhausted all my FSA funds, say in August, I would still have to wait till the end of the year. And so now if you add the rollover in as well. Let's say at the end of 2013 I have $500 worth of rollover, and that rolls over into 2014. It's our interpretation, at least at this point, having heard nothing about this from the IRS, that the $500 rollover would be eligible or would allow the participant to be covered under the FSA for $500 for all of 2014. So since they would be covered, the rollover would cover them under the FSA, they would again be ineligible for HSA, for an HSA bank account throughout all of 2014. So it's almost as if the rollover adds a whole extra year of ineligibility to the HSA bank accounts. And so I don't think that's a reason for employers not to add the rollover. We certainly have some options and some workarounds in regards to how we can get around that and how we can preserve HSA eligibility for the following year. The first and one thing, this also is significant for those with dual plans one of the plans is high deductible with HSA eligibility. So some of the workarounds, or the simplest workaround, would simply be for that FSA participant to exhaust all their funds in 2013. If the balance at the end of the year is zero, they have no rollover, they didn't elect to participate in the FSA the next year, then certainly at the beginning of 2014, they would be eligible for HSA contributions. So that by far is the easiest workaround. Some other options is if in fact the individual does have rollover funds, and we're going to build this into our plans, is to have some sort of opt-out in which the individual can essentially elect to forfeit their remaining rollover funds so that they can be a part of the HSA. And again, we'll start building that into our plans, and we'll have a way to communicate that to you employers out there. And then one additional workaround is potentially an individual could roll over their funds into a limited dental vision FSA. Limited dental vision FSAs does not preclude one from participating in an HSA bank account. And so potentially we can have a participant who has rollover funds who rolls them over into a limited FSA. And that, again, would preserve HSA eligibility for the next year as well. Jason, do you have any other input on that particular subject?
Yeah, Chris, thanks. I think the key there, as you said well, is we're still working through that. We know that there are going to be some employers either with dual option plans where some employees may switch from a PPO option to a high deductible health plan option with HSA, or some employers that may implement a new HSA option. So we want to help them as much as possible. That's why we're considering this opt-out provision, which we think is consistent with the guidance. But more I think will come on that. It's my speculation that the IRS will issue some guidance on the impact of the rollover on HSA eligibility probably sometime within the next 6 or 8 months. So I think more to come on that. But I think the good news is we've got some options there to help make sure HSA eligibility is protected. Along those same lines, some of the questions we've gotten have related to the example where the Chris, I asked you about earlier, where the employee has rollover money but does not want to put money in the next year. Would they still get the rollover money, or do they have to make an election with at least $1 in the new plan year to get the rollover funds? That's another thing that practically we're still working through. The guidance would allow someone to be a participant in the next plan year even if they didn't make an active election, so that the rollover would happen automatically. But I think the plan has the discretion to set it otherwise. So I think there will be some plans that say, employees, you get the rollover, but only if you put some of your own money. And if you don't put some of your own money in the next year, then you don't take advantage of the rollover. I think current guidance would allow that. But one thing we're still working through is if that participant doesn't want any money in the new year, but they do want their $500 rollover from the prior year, would that participant have to sign the election form with $0, or would they still sign the waiver in the new year? So that's something we're still practically working through for some of these groups that are going to be adding the rollover for the plan year that's ending in a couple of weeks. But as of now, I think the default answer is yes, that someone who didn't elect any new money for 2014, that they would still be a participant in 2014, even if they just have a rollover balance. They'll be a participant for at least the length of time that it takes to spend down that rollover balance. I've gotten some other questions about SPD updates, and to clarify what I said earlier on that, just to clarify, and let me stick with the calendar year example. The IRS notice says that, let's say the plan wants to adopt the rollover immediately for the plan year ending December 31st. Under the IRS notice, that even though the rollover is being added to this year, the plan would have until the end of 2014, a full 12 months, in order to update the SPD. That's what the IRS notice allows, is kind of a cushion period for plans. We think that's too long, and so what we want to do is, for instance, if the plan is adopting rollover for 12/31, we're going to amend your SPD for 12/31 so that we don't have to mess with it next year, that you've got a current, updated, compliant SPD right away, but the IRS would allow more time. So that's what our practice is going to be on that. On the slide here, in the interest of time, I'm not really going to say more about COBRA other than to say we are working through the COBRA issues as well, for which there's no guidance, but certainly the rollover may have an impact on COBRA, both in determining whether someone is eligible for COBRA, and as many of you know, limited COBRA applies to health FSAs, where COBRA only applies if the participant's balance at termination is higher than their contributions. They've got a positive balance. Those are the only people generally eligible to continue the health FSA under COBRA. So the rollover could impact how many people are eligible for COBRA. And the next question is, what is the COBRA premium? Do we count in the rollover dollars, or we just count this year's dollars? We think it's just this year's dollars. Those are some issues we're working through as well, both through our COBRA administration and FSA administration, and know that we're working through those issues, and there's no guidance. We may not get any guidance on that, but we do have some thoughts on best practices and how we're going to handle those situations. Now, to some of the practical questions you all are submitting in terms of what our process is and how you can implement the rollover. First, our process. Our first goal is to communicate well with you. I hope that you all have gotten our two different alerts and information on the rollover in writing. If you haven't, let us know. We'll send you another copy, and we've got a written description of the rollover and how you can choose to adopt it. We are working to update our Flex administration software, our Flex card capabilities, so that that they're fully loaded with rollover balances, et cetera, and then we mentioned the SPD updates. Most importantly, we're offering to adopt the rollover to your plan immediately. So if you want the rollover immediately, you're going to get it. If you want to wait till the next plan year, we'll do that. If you don't want the rollover at all, that's fine. We certainly think you should consider it. We think that it will eventually be standard with all health FSA plans, but that's not going to happen immediately. Here's our default plan, and let's just stick with the calendar year example just to keep things simple. Our default is that unless we hear differently from you, we will not implement the rollover to your current plan year. So if you're, for instance, a calendar year 2013 plan, our default is we will not add the rollover for 12/31 going into 2014, but we will add it to your 2014 plan unless you tell us otherwise. And we'll give you multiple opportunities to opt out if you don't want it for 2014, but our default is we won't add it to the current plan year, but we will add it to the next plan year. So if you want it immediately, all you need to do is let us know. We ask that you let us know 3 weeks before the last day of the plan year, just so we've got time to make the updates to your client file in our system, and we have the opportunity to update the SPD. Just like, again, I mentioned, our default will be we will add it for 2014. We'll give you multiple opportunities to opt out if you don't want it. We do suggest that you strongly consider, it's our recommendation that plans adopt the rollover at least by the next plan year. But again, the bottom line is whatever you want to do, we are going to do, and we'll make that happen for your plan. Here is your action plan. First of all, determine whether or not you want the rollover for the current plan year or you want it for next year. If you've got the grace period, we need to help you assess whether you're going to terminate the grace period now and add the rollover, or whether you should let the grace period stay in place and then add the rollover next. We can help you with that discussion if you need help, but just know that that's a consideration. Again, if you want to implement the rollover immediately, we ask that you let us know at least by 3 weeks prior to the plan year. If you adopt the rollover, we're going to update the SPD for you. All you need to do is receive the SPD, post it, distribute it, as you do with your plan SPDs. And then the next thing is communication, because once you adopt the rollover, you want to let the participants know, and you're going to want to promote it at the next open enrollment so that you can get more people in the plan and increase your tax savings. We will help you with that. One of the questions submitted says that would we let all participants know by email if once you adopt the rollover? That's going to be an option. We wouldn't do that automatically, but if that's going to be an option, we'll provide you materials. If you want to blast it out to them by email or hard copy, we'll provide you information. If you want us to email the participants, we will provide that as an option, and we'll give you those options once you adopt the rollover. We're still, kind of laying all those out in terms of the communication for clients adopting rollover for 1231 and beyond, but just know that all those options exist, and we're going to help you with it. So that's just kind of the brief employer action plan, which I hope reads as there's not a whole lot for you to do other than make the decision, and we'll do our best to take it from there. Chris?
Okay, and so moving on, we have one additional topic to address, non-rollover topic. Just another, this was buried in the bottom of the rollover notice from the IRS, but it's just a topic that we've talked about before. We sent out an email update on September 18th, and there was just some additional guidance provided, so we just wanted to touch on it briefly. And that's the special qualifying event option for 1114, and that particular special qualifying event is only applicable to non-calendar year plans. And what that event is, as many of you know, there's some big changes being implemented in 2014. Two of the biggest are the individual mandate and the marketplace is opening up for individuals to shop for health insurance. So as a result of those particular changes, and just in conjunction with those changes, the IRS has provided for transition relief. And that transition relief basically says that an individual can drop or add coverage sometime during the 2013-2014 plan year as a special qualifying event option. And that special qualifying event option is completely optional for the employer. Whether the employer adds the option to the plan is completely up to the employer. If the employer doesn't want to add the special qualifying event, they don't need to do that. But if they do want to allow their employees to make one change throughout the plan year, the 2013 to 2014 plan year, they certainly can do that in conjunction with the Affordable Care Act changes. And because this transition relief was written to address the changes, it is our recommendation to limit the changes to 30 days from 1/1/14, just for administrative simplicity, so you don't have participants changing one time throughout the plan year. So that's been our recommendation to employers, 30 days from 1/1/14. And the plan can elect to allow any change during this time, any change to the medical plan. This is for medical plan only. Or the plan can limit only to a specific change. So the plan could say that we're going to allow the special qualifying event option, but we're only going to allow participants to add coverage. Or they could say we're only going to allow participants to drop coverage. It's completely up to the employer. I know the two details that were in the notice regarding this from the IRS. The first one basically explained that all employers can do this. I know the initial transition relief said that this only applied to applicable large employers, those employers subject to the employer mandate, but the latest notice said that all employers can take advantage of this. And so the other part of the notice regarding this particular issue is, again, what we just said, that the employer has the option to restrict the changes that are allowed during the special qualifying event option. I didn't want to talk too long on this. I know we've sent some information out about this, and it's on the web for you if you want to check it out, and certainly send some questions if you have any questions regarding this topic.
Thanks, Chris. And just a quick point based on some questions coming in, just to clarify, this is a special qualifying event option that only applies to health insurance elections. It does not apply to FSA. So we kind of switch gears there just as a quick reminder for those that have non-calendar 125 plans, but that this does not affect FSA elections. So a couple of questions said, would this allow someone to add new dollars for 1/1 in their FSA? The answer to that is no. Chris, just taking a look at some of the other questions here as we try to wrap it up, and I know some of you may need to log off now. We're at the end of the appointed time. If you do, feel free. If you've got some time, we'll get to some of the questions now, and you're welcome to submit new questions. One of the common questions has been that if, again, just to clarify, if you've already done your open enrollment, let's say you've got a calendar year 2014 plan, and you've already done open enrollment, and participants have already made elections, but you want to add the rollover, and let's say that you're going to add it for the 2014 plan year, for the plan year that ends a year from now, would you need to open enrollment back up and allow people to make new elections? The answer to that is no, you do not have to. Now, if you want to do that and communicate to employees, hey, we're going to allow this rollover for 2014. If you want a second chance to jump in, you can. And you know, we need those elections pretty soon if we're going to, you know, get the cards loaded and everything. So, but if you want to allow people to make an election right now or tweak their election, you can do that, but you're not required to. But certainly, once the plan year starts, you're not required to open enrollment again for any reason. So we just want to clarify that. One of the questions has been from those that contribute, the employer that contributes to the FSA. You know, some of the questions have been, hey, if we, the employer, contribute to the FSA, could we allow the rollover to apply only to the employee dollars but not to the employer dollars? Unfortunately, no, because of the annual election rules. Once the plan year starts, employer money and employee money is all commingled, and there's no distinction from a compliance perspective. So there would be no way to basically divide employer money and employee money after the plan year starts. So unfortunately, that would not be an option. Another question on that special qualifying event that applies only to health insurance options is, you know, could the employer choose not to allow the special qualifying event, or could the employer choose to allow only one, only dropping or adding but not both for 1/1/2014 with health insurance? And the answer to that is yes. Chris, any other questions you see on your end?
I saw one question. I know basically all of our examples for simplicity were calendar year plans, but if you have a non-calendar year plan, you certainly can make the changes. You can add the rollover immediately. It's not limited to calendar year plans. So I know that's what we were using for all of our examples, but basically that was just for simplicity.
Chris had a couple questions about some employers on the call are putting in their FSA plan now, like they're starting a new plan for 2014, and they're asking, you know, should they adopt the rollover? What's your advice there?
I think the rollover is certainly a no-lose situation, especially if you're just starting the FSA now. For employees, and we talked about that at the beginning, the use it or lose it rule was basically the biggest reason for not participating in the FSA, and now that has gone away for the most part. I know it's only up to $500 you can roll over, but there's really no downside, especially if you're just starting your FSA now, to adding the rollover.
Thanks, Chris. And last question, just want to reiterate, I've gotten a couple of questions about whether, let's say someone has rollover funds, but they're not going to make a new election in the year, whether we're going to require that person sign an election form with a $0 balance, or whether that person, even if they waived coverage for the next plan, let's say 2014, whether they would automatically be a participant. We are still working through that issue. the short answer is I think both work. Today, December the 5th, our recommendation is that if you have someone that's going to roll over money and they want that rollover money, that they should sign the election form with a zero balance, and then they'll get the rollover money in 2014. We think both would work. Some employers are going to want to just use a default. The rollover applies even if the person waives. That will be fine. So we're planning to accept both. We're still working through what our specific recommendation is going to be. So right now we're under a obviously a time deadline because some people are adopting the rollover for the plan year ending 12/31, and those are practical issues that we're working through, and we will be communicating before the end of the year. But know that for those of you who have a calendar year plan, if you're adopting the rollover right now for the plan year ending this month, that if anyone has positive FSA balance effective 12/31, we will make sure they get the opportunity to use those funds. So we're working through those issues now. We'll be communicating more specifics for those of you that have updated it. I'm going to go ahead and shut this down in the interest of time. Chris and I are going to stay on for a few minutes, so that if you're still on and you want to submit questions through the question box, or if you've got a question we haven't answered yet, hang on for a few minutes and we'll send that to you. Otherwise, feel free to email your questions, Christopher@ProBenefits.com. If you need to discuss the rollover and whether that may be helpful for your group, Chris will be happy to talk to you. If you have any other questions, submit them to your ProBenefits administrator. Bottom line, we're going to do everything we can to help you. We do think this is a positive thing for health FSA plans. It's going to be a helpful tool for participants and employers going forward, and we look forward to working with you on it. Thanks. Have a good day. We'll talk to you later.